Hi, today we're meeting with Representative Ichiyama, and if you want to share a little bit background about yourself.
Sure. My name is Linda Ichiyama. I'm the state representative for Salt Lake and Moanalua. I've been in office since 2010, and I currently serve as vice chair on the House Committee on Higher Education and the House Committee on Transportation.
Okay, thank you. Thanks for having us here today to interview you. And we're just going to ask you some questions about the role of advanced practice registered nurses and health policy and how they can be more involved in the legislative process.
Okay.
First question is, what do you think is the role of the advanced practice registered nurse?
In a hospital setting or in a legislative setting?
I guess with respect to policy making and also in the legislative setting.
Well, I think what's important is that folks, no matter what their profession, participate in the legislative process. Because there are 51 members in the House, 25 members in the Senate, and we are a part-time legislature, which means that we have jobs outside of the session. But we are not experts in everything. And so I think that's where it's critical to have health professionals like advanced practice registered nurses to come in and teach us about your profession, about the challenges that you face on a day-to-day basis, about what you see your patients' challenges are, because we're not out there on the front lines. So I think that's always really valuable, and that can come in the form of an email to your legislator, submitting testimony on a particular bill, or simply setting up a meeting and having a conversation about things that you think are important for the legislator to know.
Okay. How do you see APRN's role, I guess, in meeting the healthcare needs of the public? I know you touched on that briefly, but if you could expand more on how you think they could be more involved in the process.
In the political process, or in
bringing, like, if they were to identify needs of their patients, like how they can bring that forward, what would be the process?
Well, there are a lot of ways that you can raise public awareness about an issue. One of the things that we do here is introduce bills and resolutions. As a bill moves through the process, it generates public discussion, and that often gets picked up by the media. And then you are reaching a broader audience on a particular issue. So some of the ways that we try to raise awareness about a topic, maybe to introduce a bill or introduce a resolution, to kind of raise the level of public dialogue on it. And if you folks are passionate about a particular issue or see a need that isn't being addressed and you want to raise awareness of it, a good way to do that is through legislation.
So would you say that it's pretty easy for not just an APRN, but a registered nurse or anyone in the public to go to their district representative or senator to propose, type of legislation?
Absolutely. I think it's one of the key roles as a legislator is to listen to your constituents, and when somebody brings forth an idea, to throw the idea into the mix. That's what we do as a part of our job in representing our community, is when we have ideas in the community or suggestions. In fact, I've introduced a number of bills for constituents, and I may not agree with them personally, but I think every idea deserves a chance, and that's where ideas get better, is through the legislative process, where you have discussion about them and hopefully come to a solution at the end of the day.
Okay. Do you have any ideas in improving our present-day system of healthcare delivery?
I think there are a lot of ways that we can improve delivery of healthcare. I see a lot of need for long-term care. A lot of folks in my community, they're looking at how to take care of their parents. They're looking at they're looking at issues of care homes. They're looking at long-term care facilities, affordability. Not too many people have long-term care insurance, or can afford to have a caretaker at home. So I think that's one of the issues that we're going to be facing. I think it's also a challenge statewide for rural areas to get access to care. And I know that's one of the ways that APRNs can play an important role is because in rural areas, they're able to provide care maybe where you couldn't get a doctor 24 hours a day, but you know, you have a nurse practitioner who can supplement and be a part of the package of care that's available for somebody in a rural area. And I think that's important too.
Okay, that brings us into a nice segue into talking about how you've helped introduce several bills that would benefit the elderly. Of some interest to us is the request for funding to conduct a study of limited mandatory long-term care insurance program. Do you hope that one day the state will fund a long-term care plan for the elderly?
I do, and I think that's why it's important that we have a group study it now. And the bill I introduced appropriates money just for a study as well as for an actuarial evaluation. And that'll give us some data long-term over how much it will cost, what kind of benefits should we offer, who should be eligible. Those kinds of criteria are really important for us to figure out whether or not it's financially feasible for the state. And I think it's important for the state to do something like this because what the state does is when private business, for whatever reason, isn't able to provide a service, the state government provides that safety net. So, for example, our state hospitals on the neighbor islands, it wasn't financially viable for them to operate those facilities, and so the state stepped in and they operate the hospitals on neighbor islands and in a lot of rural areas because the public demands those services. So I think that this long-term care insurance could be another way to fill in the gap where the private sector hasn't been able to provide insurance.
How do you envision that such a plan, I guess, would be administered? Would it be just primarily done by the state, or would it be a combination of the private sector, you know, as far as how the system is structured, especially, you know, in light of the state's budget problems? I mean, nationwide, there's a budget issue, and as well as in the federal level. How would you, how do you envision that it would be supported and funded and maintained?
You know, I think there's a lot of different models out there that we can look at, and hopefully the task force will examine each one and kind of evaluate the pluses and minuses, especially how it would fit into Hawaii's system. Hawaii's healthcare is a little bit different because we have prepaid healthcare, and so we have a very high rate of people who are covered by health insurance, but we don't have a very high rate of people who are covered by long-term care insurance. So I don't know if looking something like prepaid healthcare as a model, or looking at what they're doing under the Affordable Care Act. You know, we're creating these health insurance exchanges where there's a state sort of clearinghouse for different insurance plans, and people can shop around for different plans and find one that's right for them. I don't know if the state's going to be, you know, taking that role. There's a lot of different ways we can look at it, and I think it's important to consider the fiscal implications of each plan as they're being considered.
What benefits are currently available for the elderly, for like long-term care coverage, or even for, you know, people who are not quite, maybe just they're younger, like they're in their 30s or 40s, thinking about getting long-term care coverage? Is there some financial incentive for them if they were to, you know,
purchase long-term care?
Yeah.
I think there have been a couple of measures for tax credits for long-term care insurance, like being able to maybe deduct your premium. There's a lot of different ways that we can incentivize long-term care, and I'm not sure what's available right now in the current system, but I think what's hardest is getting people to think about it. You know, a lot of people think, well, it's so far down the road, you know, my retirement's going to take care of it, or my health insurance will take care of it, when really people don't understand that your basic health coverage is not going to cover your long-term care needs.
Do you folks have any other questions or?
Sounds good to me.
I'm good.
Okay.
Thank you so much for having us here to interview this afternoon.
Thank you.
Thank you.
Appreciate it.